I'm cueing you. He's starting the recording. So we are so thrilled to have two guests here today to talk with us about homelessness in our community. First, we have Jessica Macy, who grew up in Oklahoma, where she developed a serious love of red dirt and football. She's spent over 25 years working with nonprofits of all sizes and scopes to engage underserved or underrepresented people. She works for the Flourish Initiative as the Director of Community Programs and Coordinated Entry. In this position, she helps coordinate the Boone County Coalition to End Homelessness, Project Homeless Connect, and the By the Name Homelessness Prioritization List. Mouthful. Jessica enjoys creating connections through her community involvement, including being the past president of Women's Network, a charter member and president of the Columbia Evening Rotary Club, and an active board member with Heart of Missouri Girls on the Run. And then along with Jessica, we're so lucky to have Steve Hollis. Steve began his career with the Columbia Boone County Health Department of Public Health and Human Services in 1996 as a social worker, and then he was promoted to Social Services Supervisor in 1999. In 2006, with the expansion of the department to include the newly formed Division of Human Services, he was named Human Services Manager. The Division of Human Services works to address the causes and conditions of poverty by purchasing, coordinating, and providing social services in our community. And he considers his position to be a unique opportunity to address long-standing systemic inequity in his community. And he holds a BA in sociology from the University of Missouri. I can get this out of my face. So Steve is going to speak first for about 20 minutes. He's got some slides, and then we can kick it over to Jessica and let her say her piece. That's our plan. And then we'll have time for discussion at the end, if that's okay with everyone. So with that, let me go ahead and kick this over to Steve, and I'm going to make sure you have sharing.
Yep, I see it. Now I'll try to share here just a second. Thanks, everyone. Glad to be here, and good afternoon. I did want to quickly say we've got two of our wonderful staff here with us. We've got Carrie Utterback, who is in the semi-famous new senior planner position here at the city that got a lot of press, and Carrie has done all kinds of things for us here. She's the kind of person you do everything you can to hang on to in a department, and she's going to move from one senior planner position to another, but she's going to be the one helping us a lot with our homelessness efforts. So Carrie, thanks for joining us, and she officially begins in that role Monday. And then we've got Janie Ridgewell, and Janie is one of our social services specialists, and she has single-handedly started our public safety and justice social service program here at the city. Janie's working with our municipal court on our community support docket to provide supports to veterans and people experiencing homelessness. And then she is taking referrals exclusively from the city's public safety departments to help what we call basically our familiar faces, if you will. So these are folks that are accessing our public safety services at a high rate that have other needs that could, prevent them from having to interface with the public safety agencies. So Janie, thanks for joining us. And Janie's just done an amazing job getting that program off the ground. And then I'm going to go for about 20 minutes or so, and then kick it over to Jessica. I'm going to talk a little bit in general about the work Jessica leads, but then I'm going to leave the details to her to explain. And then we're going to hold, I think, all questions till the end. And that way, Jessica may wind up answering something, and then we'd be happy to take questions. So I'm going to try to share my screen here, and hopefully you guys can see this. Okay.
We're good. It looks great.
Excellent. Good deal. Thanks. The fun of presentations on Zoom. So as Sarah said, I'm Steve Hollis. I'm the Human Services Manager here, and I'm out at Public Health and Human Services. I actually think I know several of the people on Zoom, and I think many of you know about our department. We're a traditional public health department. We also have this very unusual human services arm, where we basically try to address the causes and conditions of poverty by purchasing social services in the community, by coordinating social services, and then we provide direct services. So that's kind of what we do. And yeah, I'd say the other unusual thing about our department is we're the last of the joint city-county departments here. There used to be several of those, and it's just down to us. And so we are, we serve the entire county through a partnership with Boone County, and we love being a joint city-county department. The issues of poverty and communicable disease don't know where the city-county boundaries are. So it's a wonderful partnership that we've enjoyed for years now. If you've seen my presentation before, I did just get it updated. We're still frankly digging out from the pandemic, and now we're into ARPA mode. So things are a little crazy here the last few years at Public Health and Human Services, but I did get a chance to update this presentation. So if you've seen it before, I do this kind of all over town. There are some updates. So, but what I always like to start with this little exercise, and when I'm in person, I say, close your eye or your mind's eye and picture a person experiencing homelessness. So I like to just take a moment and have everyone think of what a person that is experiencing homelessness looks like in your mind's eye. Okay, everybody got that image? All right. Does it look like this? I can't see all your faces. It's easier to do in person, but for a lot of people, this is the image that comes to mind. And that is, often what we call the face of homelessness. It's somebody that probably represents unsheltered homelessness. In this case, a veteran, older white guy, and kind of almost the stereotype of homelessness. And we like to point this out because it is an absolutely critical subpopulation of our homeless population. But what we like to point out is it's actually the smallest part of the population. It's the most visible subpopulation. Really, when we think about homelessness more globally, the largest population is actually people that are housing unstable, doubled up, moving from place to place, couch surfing. It's called lots of things. That's actually by far the biggest part of homelessness or housing instability. These are kind of the three big populations that we think about. We have single adults, which sometimes are sheltered or unsheltered, families with children, and then unaccompanied youth. Those are kind of the big general populations that we see experiencing the issue of homelessness. We have several overrepresented subpopulations. Some of these correlate just generally with socioeconomic disparities that we see by subpopulations, but there are some that may fare overall socioeconomically well. Let's say veterans or persons from the LGBTQ community. But they are disproportionately represented in the homeless population. Others are more typically associated with disparate outcomes socioeconomically, and those include persons with disabilities, unfortunately, still people of color. And then another group is youth aging out of foster care. You'd be surprised how many of those unsheltered guys, the chronically homeless folks that we work with, came out of the foster care system. There's a high correlation with homelessness. There really are kind of two main types of homelessness. And this is an important point I always like to make when we talk about homelessness. There are folks that are literally homeless, and that is the federal definition of homelessness. And that means either you're unsheltered, you're living in a place that wasn't meant for human habitation, so in a camp or on the streets or in your car, for example, or you're sheltered. Okay, that's the federal definition of homelessness, otherwise called literally homeless. This whole other if you think about it like an iceberg, right? So that's the tip of the iceberg. The mass of that iceberg is actually all the folks that are housing unstable. You guys may be aware that we have huge numbers of people in the country living in extended stay motels. HUD doesn't count them as homeless, believe it or not. But in our work, we absolutely consider those folks as we try to address the issues of affordable housing and homelessness. And I want to emphasize again, when we talk about the number of homeless, we're only talking about the number of literally homeless according to the HUD definition. That's housing and urban development. The schools actually under the McKinney-Vento Act do include housing unstable folks. So there's actually two different federal definitions, one for the schools under McKinney-Vento, and then one under HUD for the HUD funded services. We think about different states of homelessness. We have transitional, where people are kind of moving from one state of housing to another. A good example would be somebody getting out of jail and they're on the streets and transitioning hopefully to shelter or housing. We have episodic, where someone kind of becomes homeless. A lot of this occurs with folks that are couch surfing, so they may have a place to stay for a while, then they become literally homeless for a bit, and then they maybe get a place. And then we have chronic definition. I don't put the federal definition here because it's long, but it is very specific. It requires a disability, and it requires certain time frames of homelessness to be considered homeless. And when we measure that, you can imagine how difficult that is to determine that with somebody experiencing chronic homelessness, to see if they actually meet that definition or not. But our community partners do a great job of trying to figure that out. Okay, I talked about the numbers, and I like to talk about some of those facts before I share the numbers. You may or may not know that the way that we know the number of homeless people nationally is through something called the annual point in time count. That's required of communities that receive certain types of HUD funding. And it is a totally volunteer effort. So it is literally an unfunded mandate from the federal government. There are no resources for it, but it is required in order to receive the HUD Continuum of Care funding that funds a lot of our homeless services. We at the city have coordinated this for a long time. In most communities, it's coordinated just by a volunteer. There are many counties every year that go without a count because there's no funding and there's no volunteer to do it. So the city, through our department, has supported this effort for a long time. Now, I don't do the whole count. We just coordinate it. It's a massive effort of our community partners. And what we do is we go out and count folks on the streets, and then there's a shelter count that's coordinated. I don't want to get into the details too much, but we're part of what's called a continuum of care. That's HUD speak for the region that we're in. And that is conducted through actually these days, it's great. It's done through a computer generated system that the shelter providers use. So the sheltered count is somewhat automated these days. We used to have to do that by survey, and it was more challenging. The unsheltered count is tough. We do a really good job here in Boone County. We have a lot of community partners that go out and help us with the street count. But the other big thing that we do, we'll talk a little bit about, is Project Homeless Connect. So what we do is try to pull the proverbial needles out of the haystack instead of going out and trying to count everybody in the camps. And we still do that. But for many, many years now, we've tied the winter Project Homeless Connect to the point in time count to try to get folks to come to us and get them counted. These are the numbers that I keep for Boone County. Most of the homelessness in Boone County is in Columbia, not all of it. We see some out at Midway. We see some up at Finger Lakes sometimes, and sometimes up in Centralia. But the majority is here in Columbia or on the outskirts. And you can see there that the number of unsheltered if you look at the line, the trend is fairly flat. We've seen an uptick since the pandemic, which probably correlates with what you see in here at the state and national level. The sheltered count was way up in 22 because we had extra shelter during the pandemic. And extra funding for hotels and motels and things like that from the COVID funding. we're back down in 23 to about kind of our norm, as you can see there. And then, the green line's the total count. You can see a little upward trend, but generally we've done a pretty good job of keeping it flat in spite of the overall population increase. I know it looks like we have a lot more homeless. I do think one thing that contributes a lot is there's just a lot more panhandling, and a lot of those folks aren't actually homeless. I don't know if folks always know that or not. Now, some of them certainly are, and some of them are certainly formerly homeless, but a good chunk of the panhandlers are not actually homeless. So what causes homelessness? The big driver is poverty, lack of income or insufficient income. A growing issue in our community, in our country, is just a really almost crisis of the lack of affordable housing. Mental health and substance use disorders are a big driver, particularly of chronic homelessness, and then a lack of access to health care to address those issues. Other issues you may not think about are domestic violence, disability, and then incarceration and institutionalization, including foster care. And then, we always like to pose this question: what is the solution to homelessness, this complicated problem? And again, this is much easier in a room. I usually ask for a volunteer for the answer, but I will give you a hint. The answer is really simple. It's a home. It's a complex issue. It's also one that's incredibly easy to fix. I'm not saying we'd fix all the underlying issues, but it is one of the few social issues I deal with that is easily fixed. And it simply, we could end the issue if everybody had a home. I know that's easier said than done, but it is simpler than most of the issues we deal with. At least the solution is. So what do we do about homelessness? And this is where Jessica is going to go into more detail about some of the processes we use. We have a coalition. That coalition meets as part of a larger statewide and federal approach to trying to get people into housing using a systematic approach we call coordinated entry. I'm not going to spend a lot of time on that because Jessica is going to talk about that in detail. I will say Columbia has really kind of led the way in the state on this approach over the years. And again, I'm going to let Jessica focus on this. I'm going to talk more about some of the resources. We mentioned the way to fix homelessness is a home. The single largest provider of affordable housing in our community, in our country, are public housing authorities. We happen to have a wonderful housing authority here with a great partner, Randy Cole, who actually used to run the city's housing programs. He's deeply committed to increasing the stock of affordable housing in Columbia. They have two types of housing that they provide. It's the traditional public housing that they own and operate, but also the housing choice voucher program, formerly known as Section 8. So that provides vouchers for people to go out and rent housing on the open market. Easier said than done in Columbia. And we have a growing stock of permanent supportive housing. Some of this is through vouchers and through public housing. Some of it's held by private nonprofits like New Horizons and Burrell, or Boone County Family Resources. And this is permanent affordable housing, but it comes with supports. And those are really important, particularly with our chronically homeless population, as we try to get them housed and keep them housed. Another way to handle homelessness is to prevent it. So we do a lot of things with rent assistance and utility assistance. That can be both prevention, meaning we stop someone from losing their housing due to inability to pay rent or utilities, or we get them out of the shelter, off the streets, by helping them with rent and or utility assistance. Emergency and transitional shelter. We're very fortunate to have decent shelter resources. It's never enough, especially in the summer. But relatively speaking, for a small Midwest city, we've got a pretty good stock of emergency shelter. We have our longstanding general population shelter, the Harbor House. We worked as a community to build a new home for BoCoMo several years ago now. We have a room at the Inn, True North, our domestic violence shelter, and now very fortunate to have a youth shelter again. We had a youth shelter with Rainbow House that closed a few years ago, and now we've got Flourish with actually a tremendous amount of support from Veterans United. Hotel motel vouchers are tough, but we still do have those. The agencies tend to use those for very short-term interventions because it's a pretty unaffordable solution. We have then harm reduction services. So for our folks that are out on the streets, we've got Turning Point, our homeless drop-in center, which has grown tremendously over the last 10 years or so. Loaves and Fishes, our longstanding soup kitchen, the city's warming and cooling centers, and then our overnight warming center, which Turning Point's operating for us this past winter. I screwed up my slide story. So this should have been backed by rent. I'm sorry, guys, but this is the utility assistance I mentioned. And I want to point out, affordable housing isn't just the rent. Utilities play a huge role in housing affordability. We see lots of folks who can afford their rent, and then they can't afford the gas bill when winter comes. It's a huge issue. We also do a lot of street outreach. We kind of got two groups doing that. One is our longer standing homeless outreach team that's now staffed by New Horizons, the VA, and Burl. They go out on Fridays to all the camps and known locations and do outreach. But in recent years, we've had our friends at BoCoMo Mobile Aid doing a lot of great work, much more kind of intensive supports around basic needs and food. And so they're one of our newer partners, and really love and appreciate their energy. And some good street outreach efforts. Nothing like, say, San Francisco, but pretty robust for a small Midwest city. I mentioned our Project Homeless Connect events. I know Jessica's going to talk about those briefly, but that's, again, where we pull all the providers into one spot. So particularly our sheltered and unsheltered friends can get services all in one spot, again, with the goal of just wrapping them in services towards the goal of housing. I want to talk a little bit about our justice initiatives. A lot of our folks that experiencing homelessness have over involvement with the justice system. Not always, but a lot of times just on minor charges like trespass and things like that. I'm not trying to minimize, that there aren't impacts, but a lot of cities and counties across the country are trying to basically decriminalize homelessness. We took that very seriously. Janet Thompson and I kind of did a lot of work on this through NACO several years ago. And I want to talk about some of those initiatives. I was sorting these slides like till just 5 minutes before we started. So I should have taken treatment courts out because I've got that under the county. But we're running the municipal court community support docket. Our wonderful municipal court judge Kavanaugh Nose started the support docket. And again, what it does is it tries to get veterans and people experiencing homelessness off the regular docket and then provide supports with the idea that what we really want to do is get their sentence suspended or their case dismissed because they're cooperating with social workers that are helping them along the path to better things in their lives. So Kavanaugh has done a great job. And then the city added part of Janie's position to help support the community support docket. And then also to help our public safety agencies with those familiar faces to try to reduce their interface with our public safety agencies. We tried to hire a mobile crisis team at the city, but due to the job market and I hope there's no council people on the low city pay, I couldn't hire anybody. Just to be blunt, I don't think it's any secret that city's having trouble with hiring. So we have just issued an RFP to try to contract for not a mobile crisis team, but co-responders with police. So hopefully more to come on that soon. I've been working really hard in the last few years and have not had much success. So I'm hoping this next step and this change in approach will result in some help for our police and for our residents. The idea there basically is to try to send a mental health professional with a police officer to avoid further interaction with police for mental health issues. The other reason we went with the co-responder model, I'll talk about this briefly, but the state of Missouri is actually investing heavily in crisis response services, and I'll talk about those. And they're going to be creating mobile crisis teams through their community mental health providers. I'm going to jump to the county. You can see I tried to delete those out of that prior slide. The county's really led the way in a lot of this stuff through the treatment courts. So they've got alternative sentencing courts. Janet and Kelly Wallace and I worked on implementing a jail brief mental health screener several years ago, and that's still happening. Dwayne Carey's been really supportive of those efforts. And they're still doing jail case conferencing. So folks that are in jail with significant chronic mental health issues are case conference while they're in jail, both to manage the mental health care there, but also hopefully to have a good transition out into the community. So the county's just done a great job in that area. That was part of the Stepping Up initiative that Janet Thompson was really heavily involved in, and we implemented some of those best practices here in Boone County. I'm missing my state slide, I think. Sorry, guys. I just was sorting these. Anyway, I'll find it somewhere here. But one thing that comes up is who pays for this. It's complicated, like social services in general in America are. You go to other parts of, say, Europe, and social services and health services are much more centralized through state, local government. Here, it's a hodgepodge. You have anything from volunteers to churches to the federal government running social services or funding them. So, when we think about the suite of services here for homelessness, they're funded by all kinds of sources, federal sources like HUD, state programs. Some of the state money in Missouri, frankly, is mostly federal pass-through. There's not a lot invested by the state of Missouri in homelessness, if any. And then a lot of local government support here in Columbia and Boone County. City of Columbia is a big funder of social services. The county now, through the Children's Services Tax, is as well. And then philanthropic and support orgs like the United Way and Veterans United Foundation. And then faith groups are a big part, especially in our homelessness arena. And then obviously, all the nonprofits rely on private donations and volunteers. Since I do this for the city, I always like to talk about what the city does. And so generally what we do is, we contract with providers. So we're a funder and we buy services out in the community. So we buy shelter services, mental health services, things like that. We work in close coordination with the county and the United Way and Veterans United and Foundation for Health. To do that, we have a really unusual and unique Boone Impact Group as our local funders collaborative. I could do a whole presentation on that sometime if you guys would like. It's really not much like it in the whole country. And we also provide direct social services and healthcare services. We do a lot of coordination out in the community because, again, in social services, nobody's really in charge. So I would say one of the most unique things the City of Columbia has done over the years is to play this role in the community of coordinating social services. That's very unusual, actually. And then we leverage a lot of state and federal resources and either use those grant funds for city stuff or reallocate those in the community. And then we lead emergency response and recovery. So in the pandemic, we ran not just the public health response, but we ran the social service response. That meant sheltering, trying to figure out how to quarantine people that don't have a home. Not an easy thing to do. How to get people food that are quarantined. We also lead the mental health response. So we played a big role in the pandemic and not just on the public health side. Here's my state updates. There's some good stuff going on. I would 5 years ago, I never would have dreamed some of this stuff was happening. Medicaid expansion, massive development especially for our homeless folks who can now get health care. That's huge. 988, the rollout of the mental health crisis line nationally and in Missouri has been big. The state is now funding these behavioral health crisis centers through their community mental health providers. Ours for this region is Burl, and they've opened theirs. That's just something we dreamed about for years. And then they are in the process of funding and implementing these mobile crisis response teams. Those will be implemented generally through 988, and that's going to be a big development. It's also part of the reason why we at the city pivoted to more of a co-responder model with the police. And then they have implemented these community behavioral health liaison programs too through their community mental health providers. And by they, I mean Department of Mental Health. And those are basically assigned to police departments and county sheriff's departments to help provide basically support and technical expertise to those departments when it comes to mental health, and then be a liaison to the community mental health provider. And I'm listing both good and bad things here. We also had House Bill 1606 passed. It's a little unclear what the consequences of that are. It's often referred to as the camping ban. What it does is it technically just bans people from camping on state lands. There are also some really kind of, I would argue, vague parts of the legislation that seemed to set things up to punish local communities by withholding funding if certain conditions were to occur. Haven't really seen how that's borne out, but that is something interesting that's happened. And I guess I would say it represents a bit of a trend where there seems to be both a lot of support to help homelessness. On the other hand, there are a lot of efforts to basically criminalize homelessness. I'm not passing judgment there, by the way. That's just an observation. Other developments in the community, as I mentioned, we have now that youth shelter, which is a huge addition. A big thanks to the Flourish folks and Veterans United for getting that up and going. Jessica's our coordinated entry coordinator. We haven't had a paid position to do that, so that's been a huge help. The opportunity campus that I'm sure you guys have heard about is hopefully in process. Randy is redeveloping Park Avenue, and that will include some housing dedicated to folks exiting chronic homelessness. Turning Point's expanded their days and hours of operation. Room at the Inn is in the process of planning for year-round operations. BoCoMo Mobile Aid has gotten so large that they incorporated and they're now 501c3. And then again, I should put the bad news on the front end, but Phoenix program's closed, which is kind of a big loss for our community. At the city, just quickly, we've done a lot, as you guys may have read in the paper lately. We contracted for that plan for a comprehensive homeless services center. That's been a little bit, but that seems to be coming to fruition. Instead of having the overnight warming center at Wabash, we're now contracting with Turning Point to have a bit safer and more structured environment there for cold weather, for extreme weather, and basically for folks that can't very easily be sheltered at our traditional shelters. We've significantly increased the funding for Room at the Inn. Again, for Turning Point to increase their hours of operations. We worked out something in the winter where Room at the Inn staying open till noon on Sundays, and then Turning Point's opening at noon because Sundays were a big hole in our warming center services on the weekends. So that's been a nice development. We bought the Ashley Street Center, and you guys know that, probably know that Room at the Inn operated out of Ashley Streets this winter. So they had one location instead of having to bounce from church to church, which if you've volunteered at Room at the Inn, that has been a huge help. We also were able to almost double our capacity. There were some churches that could host quite a few, but most were averaging around 40 to 50. So we were up around 80 to 90 at Ashley Street Center. So that was great. And then, as I mentioned, we added Janie's position. We now have a contract for street outreach with John Trapp for a change. So John can actually go out and address issues that the city identifies with folks experiencing homelessness. That's been a huge help to me personally. The city manager allocated $600,000 for utility assistance. I cannot overstate what a big deal that is. I will tell you that the amount the city allocated for as long as I've been here was $4,045 a year for utility assistance. The rest was based on donations. Our current city manager initially allocated 300, and then he added another 300, and then it looks like we're slated for 600 next year if approved by council. And then you guys have probably heard a lot about ARPA. So we're issuing these RFPs for ARPA. Proposals are due today. And a big emphasis there is affordable housing and homelessness. I did want to point out under the current leadership that our investment in social services in general has increased, but our investment in services to address homelessness through our social services funding has gone from $68,000 in 2016 to $482,000 in 2023. Not to mention that the city manager bought the Ashley Street Center and has done a variety of other things to support the issue. What do we still need? We do still need that 24/7 drop-in center and shelter, but I think that's in process all these years. I can't tell you how happy that makes me. I've been working on that for 15 years and I'm retiring next year, and I'm hoping that happens, that I have some assurance that's going to happen before I retire. We do still need more family shelter. So one thing we're talking about is the possibility of converting maybe an existing shelter to focus more on families if we have more capacity at an adult shelter. We really struggle with isolation and quarantine during the pandemic. Every community did. That's something that we've really got to tackle. We're hoping for some federal help on that. We always need more rent and utility assistance. We need more rental incentives for landlords, and Jessica can talk about that a bit. And we just need more affordable housing, and that's every type, everywhere, and it's not just in Columbia. It's just, I would say that's probably one of the bigger crises right now, besides our opioid epidemic that we're looking at. And always need more mental health services. Now, Medicaid expansion has been huge. We are in the process of starting these interventions to try to get mental health folks out instead of just law enforcement. It's not a bag on law enforcement. They're not trained to do that work. We want to be on the leading edge of this different approach to crises. And then I would say, even with Medicaid expansion, we still have a massive shortage of psychiatry. That's a national issue. It's acutely bad here in Columbia. Next steps, we're going to well, we did hire the Carrie's position. So Carrie's going to hit the ground running here. She's going to be taking over some duties from Jessica. And then we're working on the Ashley Street Center to do some renovations, with the idea that we might move Loaves and Fishes and/or Turning Point in there until the Opportunity Campus has been built, to relieve some of the burden on the poor North Central neighborhood, which has borne a lot of the burden of homelessness in our community. The city manager has included some things in his budget for next year that we requested as part of the city's strategic plan. That includes continuing the street outreach contract, funds to operate room at the end year round, and then to increase Turning Point's hours of operation and staffing. And then that ARPA process is rolling out as we speak. You get through this stuff and you think, what can I do? I'll tell you, volunteers still make the world go round. The Soup Kitchen and Ratty and other agencies are in perpetual need of volunteers. And then money. I mean, I hate to say that, but all the nonprofits rely on donations, and donations nationally are down due to the changes in the tax law. So if you have a little bit to give, boy, the agencies could use it more than ever. And then, the last thing is make your voice heard. Columbia's great about that, but it still really, really matters, both at the local, state, and federal levels. That's me. That's usually an hour presentation. I didn't keep it to 20 minutes, so my apologies to Jessica, but I'm going to stop sharing and turn it over to her.
All right, well, I will start sharing. Oh, as soon as Steve stops sharing.
Sorry.
But as Steve said, I'm Jessica Macy. I'll just jump in a little bit and start talking. I work with Flourish Initiative, and we are a teen shelter. My job predominantly focuses around adult homelessness, but I do want to give you all a little bit of information on Flourish and what we do. Make sure I share the right screen. Okay, I think that's it. Can you see Flourish? Okay. All right, so Flourish started in 2019 after 111 community interviews conducted by Veterans United, because they had a partnership with Douglas High School, and very quickly realized that a lot of our children in school have more problems than just education. Like, they're not, just because you're not keeping up in class, that's probably the least of your problems for some of our kiddos. And out of that came a 10-year, $10 million commitment from Veterans United to work with kids and their families who are trying to overcome the barriers of poverty and so many different issues. So obviously, if anybody knows Dr. Neville, she was a driving force behind this, of us kind of getting up and running, and she's still on our board of directors. And our mission is really just to weave resources together so families and youth can flourish in our community. How it all works and got started is kind of a three-legged stool. So most people in our town have heard of Veterans United. The foundation provides most of our operational funding. And then we have this really unique opportunity to work with Veterans United Home Loans, which is what most people think of when they hear VU. They staff our executive board. They provide funding for scholarships. They help with program development. And as somebody who loves the inside of management, they also provide a whole lot of back-end support that most nonprofits either don't have the expertise in or have to pay a lot of money for, like HR, legal, accounting, volunteer coordination. And so Veterans United helps us with all of those things, and they help place interns. We have our internship program started last week, and we'll talk about that just in a minute. And they provide a ton of mentors for young people in our community. And all of that goes to support the work of Flourish, which is more than a youth shelter. We have basic needs support where if there's a student whose family is maybe struggling with, a car got towed, or the utility payment's not made, or they're really close but just can't make this month's rent, they can talk with their counselors, they can put in a request to Flourish, and we can help with some direct support and direct funding. Along with that comes case management and our youth specialists who work very closely with those families to make sure that whatever needs they have, we can do our best to meet or connect them with other organizations in Columbia that they can work with. So that's how it all works. But what does it really do? These are our I didn't update this to say to the right year. Okay, so these are 2022 statistics, not 2019. So sorry about that. But we've housed over 20 youth at the youth shelter and almost 3,000 bed nights, over $500,000 in scholarships giving out to students of color. Now we're probably pushing close to 75 interns with the two classes that just started. Those internships are paid, and they do part professional development and part work at Veterans United. So they gain professional experience as well as professional development. About $50,000 worth of basic need requests have been fulfilled, and those are things like the rent, the utilities, what a family may need to not become homeless. If there's a way that we can fill that need with a small check, we've got a pot of money to be able to do that. And then 185 Veterans United employees have mentored over 100 students with 500 hours of mentoring. A lot of folks know in Missouri that we have the ability to have 529 accounts for our children to save for their college or further education adventures. Flourish has a program called Saves. And so when youth qualify for that, and most of our programs, the qualifications are you have a barrier in your life. We might do a little bit of asking around about what that is. For most of our kiddos, it's poverty, might be race, might be gender, might be sexual orientation, gender identity. If they have a barrier, they can qualify for most of our programs. But with Saves, when those kids come into that 529 program, as many of our working families or even families in poverty, you're working to survive and you're not really thinking about how do we save money for college. So the kids can do activities, and the activities are worth money. And Flourish puts money into those 529 accounts for the kids. And immediately when they sign up and do their first activity, we drop $550 into their 529 account. $500, there's a lot of research behind it that really helps kids go on to continue their education and encourage them for whether it's community college or trade school. But that $500 is a tipping point. And so we start them out with that, and they have the ability to earn up to $2,500 in that program through the internships and scholarships. If they stay with the program the whole way through, they could have upwards of $10,000 to go to college. And this is kind of what it looks like for a little bit more visually. So you start with Saves and start saving money for program or for college. Then when you're a junior, you can be an intern. Then ideally all these kiddos graduate high school. Then they can be offered another internship for Veterans United. And then after that, they get a scholarship to go on. So we know one of the ways that we can break some of the cycles of poverty is by filling the gaps in education. And this is one of our local attempts to do that. All right, so that was all about the Flourish initiative and the kids side, but I am on the adult side. And so when I came in and Steve's talked a little bit about this, there was this great group called the Functional Zero Task Force. What does that mean was my first question. And so we worked with the group to figure out maybe what a better name is. So now it's the Boone County Coalition to End Homelessness. And this group gets together, make sure I get my slides right. A little bit of history. So it did start, and Steve had this on his slide, part of the health department's Basic Need Coalition. And then I became the first staff person, and we have between 20 and sometimes upwards of 30 organizations who meet every 2 weeks to talk about what resources are out there and help allocate those resources to our most needy folks. This is what a lot of people see as the housing continuum, right? Like on that red side, the far left, you see homelessness, and on the far right, we've got these beautiful market value homes that we all live in. My problem with this slide is there aren't a whole lot of arrows that go backwards. We just think, well, we'll get somebody into a shelter, and then they'll get transitional housing, and then they'll get into the housing authority, and then poof, they have a beautiful home that they live in. We all know from just our own personal finances, most of us, that we live in a very unstable world and a very unstable economy, and those arrows go back and forth all of the time. So ideally, this is what a continuum would look like. But we have a lot of folks who go from homelessness into shelters, back to homelessness. We have a lot of people who start potentially in affordable housing, and then a life issue happens. You lose a job, there's an illness, there's a divorce, there's a crisis, and boom, you're homeless overnight. And so it's not quite this clean. Ideally, we would love to see it look like this, but it's just not this easy. Instead, for a lot of our folks, this is what it looks like. Is there's this, when you're somebody experiencing homelessness and you are looking for help, there are all these crazy wild arrows and curves, and some of these lines should probably even have loop-de-loops in them for the circles that our folks have to run through to try to access resources. And so whether you're a family or somebody camping or maybe somebody leaving a hospital or a jail, how do you even start to navigate where you need to go? And we do a really good job, most of our agencies, of bringing people in and trying to help them. But you end up at VAC and you get some services there, and they send you to Love Columbia and you get some services there. And then you got to go over to the food bank and get your box of food over there. And so it is a full-time job when you are a person living in poverty to try to make your needs get met, as well as trying to work a full-time job. So a lot of our folks deal with really this type of diagram that, again, all the arrows point down, when most of those arrows should have arrows on the other end, because you get to the shelter and there's a wait list. So you end up back at the camp, or you go to Turning Point and you get some services and things start going really well. And maybe you start working with an agency, but then you might end up in the hospital. And so, as everything, this is very much a cycle, and it's not linear at all. So here's some fun government speak. I feel like I have to throw this slide in so people can understand a little bit about what it looks like. From HUD, they designate regions, as Steve talked about, and we're kind of that big purple region right in the middle of Missouri. And all of the white areas are self-governing, kind of take care of themselves, and we're all called continuums of care. And so we're in the middle of all of that big purple area, and that's Region 5 of our continuum of care. But in Boone County, while we work with all those other counties, we also work within the county ourselves to hold our own meetings and to kind of work at a local systems level to try to fix things. So most counties in the United States are covered under a system like this, and that system is designed to promote coordinated entry. So coordinated entry, to put it really bluntly and quickly, is to take those really crazy loopy-loop arrows and try to make them straight. So through coordinated entry, we prioritize people. There's usually very specific access points where you can go to get a survey or to get an assessment. And then you are prioritized on what we call the by name list. People hear about the list all of the time. It's either the by name or prioritization list. And so folks who are experiencing homelessness take an assessment, and that list helps us triage folks. And so the people who are most vulnerable and people who have the most need are the first ones on the list. And huge shout out to those 20 plus agencies that participate in this system. Since I've been doing this work just for the last 19 months, we've housed the number one person on our list 5 times, and all 5 of those people are still housed. So that speaks to this idea of coordinating the services really does work when we have the time and resources to make it work. And ideally, we can make it look hopefully a little bit more like this. This is the goal. This isn't necessarily where we are, but we see kind of a lot of nice straight arrows, straight lines, one point of access where you can go for problem solving, assessment, prioritization, and referrals to what's out there in the community. I really do wish it was this simple. It's not. It looks great here. This is the goal. But every organization, I think, that works within the continuum of care really believes in this type of system where we are trying to make it as easy as possible to connect the people with needs with the resources that are out there. So there we go, going from the crazy lines and arrows to the straight lines is the whole point. Trying to make it easier to connect the need and the resources. Other things to know, Steve's talked a lot about the point in time count, so I'll just skip it over that. But Project Homeless Connect is June 29th at Missouri United Methodist. They've been our home for the last year, hosting us twice a year. Folks can come in and get whatever resources are available. We've most recently added Compass Healthcare, formerly Family Health Center and Family Dental, have a dental health bus. And at last year's event, excuse me, I got a little drink. We had 9 extractions in the dental van in the parking lot of Missouri United Methodist. People who needed healthcare that quickly, excuse me, and that much. So this year we will continue that. We also have folks from MedZoo who are doing physical health. All of our mental health partners are there, as well as the shelters. And people can come in and get a haircut, a backpack full of resources, excuse me, and a lunch that day. So it's an opportunity for us to try to meet people where they are, because as BoCoMo Mobile Aid is amazing at getting out to the camps, for a lot of nonprofits, it's not as easy. So we try to get folks to that one place twice a year to give them as many resources as possible. The Housing Stability Program was a pilot program we started this year with the idea of, I don't know, I kind of just say it this way: if we can buy it done, we should buy it done. And so can we offer money to people to get things done more efficiently and effectively? We're having a very difficult time finding landlords who will take housing vouchers. There are a lot of different kinds of housing vouchers, a lot of different types. Most of them have all of the same requirements when you're a landlord, but landlords have had bad experiences. I try to remind them they've also had bad experiences with college students. So there may not be a whole lot of difference between the populations that they're working with. So the Housing Stability Program offered landlords a $500 incentive to take a housing voucher. And then once they house that person, we held $1,000 basically in escrow. So the landlord could come back after the person moved out. And if there were damages that they could prove above the, what's the word I'm looking for? The deposit, or the fees that you pay to rent the apartment, then we would make good with at least $1,000 of other funding so they could fix up their homes. So far that was hugely successful, but we ran out of money in about 4 months. So I think that will be a program that we continue to look for funding for, and continuing figuring out how to engage landlords. Just as somebody who probably spends way too much time on social media, I've recently seen a lot of just posts of people looking for rental property. And it can be somebody just as simple as, I'm looking for a 2-bedroom house, single mom, 2 kids, up to I have a felony or I have bad credit. And it's a gamut, runs the gamut of difficulty in finding rental housing in our community right now. So the Housing Stability Program was designed to help improve that. And Steve also touched on this, but I will run down probably pretty much the same list that he said of how do you get involved? What do you do? If you donate stuff, please ask an organization if they want it. Nobody wants your 1985 CRT monitor. Sorry, hate to say it, but a lot of us have really good intentions when we donate things, but please talk to organizations about if they need what you have. Hands-on volunteering brings it all home, whether that's through BoCoMo Mobile Aid, Loaves and Fishes, food pantries, stocking a little pantry, working with the wardrobe, doing clothing, all the way up to you could sponsor a transitional home through some local organizations and help people move through that continuum of housing. You can help us find landlords who are willing to take vouchers, who are willing to work with our agencies and the folks that they're serving. And most importantly, advocate on the state and local level. Usually I'm a little bit more middle of the road on this, but since I'm not really in a middle of the road kind of organization, I would tell people, I don't care what you advocate for. Well, I actually do care what you advocate for, but I care most that you advocate and make your voice heard. And you all are obviously probably more expert at this than I am even, and let our legislators know, or our city council people or county commissioners, whoever it is, let your voice be heard. Don't let it be quiet. It is much needed. And there is a place for everybody's opinion. One opinion does not make another opinion necessarily right or wrong, but please engage in the systems. If there are problems, please let people know what you see and what you think possible solutions are. And there is our information for Flourish, as well as the Coalition to End Homelessness. We have a Facebook page and a website. If you are ever curious about I've been in the nonprofit game for about 30 years. I thought I knew a lot of acronyms until I got involved in housing. There are a lot of acronyms out there. So we have a lot of information on that website about what all these acronyms mean, what types of housing vouchers are there. Just lots of really good information out there if you need it. So I will stop talking and see what questions we have.
That was great, both of you. Thank you so much. Alice, I see you already have your hand up. You want to go ahead and go first?
Okay, thank you. Okay, this is on utility help. Both Jessica and Steve have mentioned it many times in their talk. Have either of your programs, and this is harder for Steve, weighed in the proposed city utility increase, which, quoting the Missourian, would put in a rate structure, and the hearing's June 20th, where the more you use, the less you pay, a very old-fashioned rate structure. According to the Missourian article in early March, this would be about a 3% increase for largest users, about almost a 14% increase for residential users, which is going to put more people in need. Now, Steve mentioned $600,000. Very generous of the city manager. That was needed in the past, but is some of that based on temporary funding like ARPA? Can we do that every year? There is Jim Windsor, formerly with Water and Light, has tried to raise the issue that city staff need to weigh in on this. It's all based on a consultant's report, this proposed increase, and he says there's a lot of fault in it. So I'll let you answer. Thank you.
What's your question, Alice?
Have either of your program weighed in, or are you willing to take a look at this?
That is way above my pay scale.
Okay. Okay, Jessica?
I personally have weighed in, but I will say from the coalition, that's one of the things we put forth, all of these things to the group so people are educated about that. As a coalition, we don't take stands on, we have not yet taken a stand on supporting one thing or another. I think right now, because we're kind of in that developmental phase of getting our feet on the ground, we are definitely educating our folks so they can figure out where they're, because also speaking for 30 agencies is really hard.
Yeah,
And
sure.
getting 30 executive directors to all agree on something, unless if you want $1 million, I don't know that they're going to agree. So, but we're definitely educating people about all of the opportunities to engage with all of our funding mechanisms.
Okay, well, maybe I could have Jim send his 2 short reports requesting that city staff be able to do some calculations on this. That's what he's asking for, which might differ. He's proposing would differ from what the consultant's proposing. So thank you.
It seems reasonable to me that whoever's doing the work might be better situated to assess suggestions. Anyone else? I'm looking at the chat. I don't think I've missed any questions. There was Alice sort of had an implied question about the $600,000. And is that something that's renewable?
Yeah, so that was general revenue, actually.
Okay.
So both allocations of 300,000 for fiscal year 23 were general revenue. It's already, as I understand it, 600,000 and GR has been included in the city manager's draft budget. Just want to be clear, that's his draft at this point.
Yeah. So as long as that goes forward and has support, it should be renewable. It's I guess at the city managers, and then whoever approves the budget beyond.
Yeah, it's not ARPA. I think Alice mentioned ARPA. It's not ARPA. It's
city money. Mitchell in the chat asks, how is the hiring process for the new Opportunity Campus director going? I don't know, as much as you can say. I know personnel is probably a little private.
I think maybe that speaks to a little bit of a misunderstanding. So that has nothing to do with the city. That's a private project. Now the city's, they have proposals pending for ARPA funding, both the city and county, but the Opportunity Campus is a private project being led by Voluntary Action Center. So I can't speak to that. I don't that would be a question for that group.
Fair enough.
We hired I think that got conflated with the senior planner position that we hired. And that was really just to be frank, that's just a position we needed because we're overwhelmed here. Believe it or not, it's still just me. Literally, if you guys knew Phil Steinhaus,
Yeah,
he had this
he's
job
great.
20 years ago. I had
Yeah.
the same staff that he had me. So that position really was just meant to help us because we were just drowning. But
And you've hired someone, or you're looking?
Yeah, so that's Carrie, who I introduced.
Oh, right.
Carrie, a big part of that, just because homelessness takes up so much of our time and resources, Carrie's going to be working a lot on that. Also, the generous grant that Veterans United has provided to pay for Jessica's position is running out. They agreed to, about 3 years on that. So we actually used to, in the old days, when we were our own continuum of care, had a position that was funded through the federal money. When we joined the balance of state, we no longer had that position and haven't had it for many, many, many years. So big shout out to Jessica for kind of formalizing things, getting things going, and then Carrie's going to be taking over a lot of those duties as a city employee. But the Opportunity Campus is completely separate.
I guess just for my clarification, because I saw the city council was discussing it. It was on like one of their previous meetings. They're talking about, and I think in the memo it said like they're looking to add funding for that position. So why if it's a private thing, I guess, then why was the city council discussing the extra funding going towards that?
You'd have to ask city council.
Fair enough.
I can't
Don't
speak.
have anybody here yet today. Pam, I don't know whose hand is
Sarah,
up first, but
Pam
Pam, I
and-
see your hand. I'm sorry. Kathy, did you want to ask a question?
I was just going to tell you about Pam.
Oh, yeah, I see your hand, Pam. What would you like to ask?
Last week on the radio, a person who leads this radio program made a statement that housing first never works. And I would like you to comment on that.
Housing first being just putting them in a house first?
Right.
Is that what housing first means?
Well,
Okay, so I'll speak up on that one.
I'll give you a local example to counter that, and that's Patriot Place. That was a huge effort of our community to build a new home for Welcome Home, but also to with the partnership between the Columbia Housing Authority and the VA hospital to build Patriot Place. And it is very much based on a housing first model that we're simply moving veterans off the streets and out of shelters into permanent supportive housing, and they've had great success. And
It's good to know.
And our
just
veteran
heard-
homelessness numbers are as low as they've been in several years. And any of you who know Jane Williams, I would echo what Jane says. I believe in housing first, and I do believe it works. It's housing first, but not housing only.
Right.
There's a lot of other things that have to go with that.
Sure.
But if you can't help somebody if they're living in a state of fear of no resources.
Mm-hmm. And that's what I hear both of you saying when you do this work. I hear the word weaving or wrapping supports around and again, trying to make it easy, right? So when that person comes in for services, they don't have to go to 8 different offices. They can hopefully, because they don't even have transportation most of the time. They're on foot. Getting to 8 different offices all over town is not practical. So that's great. Hope, is this your question that you had your hand raised? Do you want to go ahead and ask it?
Oh, well, that was kind of a spin-off question, but I
Ask
also
both.
but I also, Steve, I wanted to ask you, hi, Steve and Jessica, nice to see you again. But I wanted to ask you if there's any information public about potential plans or the idea of moving Turning Point to the Ashley Street Center after showers and laundry are installed there.
Yeah. So first of all, I don't know if showers and laundries are going to be installed. That's being explored right now. That was in my report to council. If you guys haven't seen that report, I just submitted in May a really comprehensive report of things that we've done recently and also next steps. One of those next steps is we're in the process of working with a mechanical engineer, an architect, and a contractor to check the feasibility of adding showers. And as you guys know, the supply chain issues are still very real to the extent that it may not be feasible to try to do this before. The idea would be to try to create a somebody, I think I've seen the term kicked around. We've been calling it the bridge to opportunity, meaning could the Ashley Street be a bridge to the Opportunity Campus? It's going to be dependent on the cost. And frankly, you know, one of the things we're hearing is like, we can't get cooling systems. Like you literally just can't get them. We're in the process of getting preliminary plans, preliminary timeline, and preliminary costs. Those will be given to the city manager's office for their decisions to make. I can tell you that, you know, the contract with Brady does lease the building to them again through December. I'm assuming they'll be entering a new contract with us. My thought, what I've been telling people is, I think at the very least, Ratty will be there. We are working towards the possibility of Turning Point and or Loaves and Fishes. But I also want to say it's not our choice to move them. They don't have to move. What we're trying to do is create a space where they may have the opportunity to provide the services. And obviously we're doing that in close conjunction with those providers. So it's a two-step thing. Is it feasible? Is it something that they want to do?
Great. Mary Jo, what's your question?
Steve, where can I get a copy of your report?
I can email it to somebody and then send it out. It's on, you know, it's buried in the city, you know, it's one of the reports for the, I can't remember which May meeting, but I'll just send it to somebody and then
if you can send it to Pam, do you have her email address from when you were emailing? If you could send it to Pam, that'd be great. And she can send it out to everybody with the announcements.
To add to that, I'd like to get both PowerPoints as well, if that's a possibility.
I can convert mine to PDF and send it to you.
Great. You know, I just realized, Justin, I forgot to announce office holders. Hello.
Hi. I think there's one more on here as well.
There's Scott running for office, and who am I missing? Roger. Hey, Roger, I did see your name.
Yep.
Yeah. Usually at the beginning, I introduce any office holders and candidates. Sorry, I just blanked it with all the other stuff I was talking about.
Well, thank you both for your presentations today. It was wonderful.
Really good. Yeah. Any other questions? It is about 10 after 1, so we want to be respectful of our time, presenters' time, but I bet they would take one or two more questions. Yeah, Sue? You need to unmute yourself, love.
I have a concern because I heard that Reverend Bryant is being moved by the Methodist Church. And if he's moved, I'm also a little afraid that the whole church may fold or may be closed by the Methodist. Are you hearing that too? Because that would be, okay. That's just.
I haven't heard that. I know Brad's moving. That's a bummer from my perspective. But it is part of their system and their approach. I haven't heard anything otherwise. I would go back to, we're doing everything we can to try to see if we can provide a space as an interim solution if possible. That's where I'm putting my energies.
Great. All right, I think I'm going to wrap this up unless somebody has one last burning question, and I'm going to hand this over to Pam. She's going to do the announcements. Yeah, thank you both of you for being here. This was really, really good. I knew it was going to be, and it was. It met and exceeded my expectations.
Thank you both very much.
I had high ones, so thank you for being here. We'll do announcements. We'll conclude the general meeting. Anybody's welcome to stay for any of this. We'll conclude the general meeting